My name's Tisha. The other day I'm going to be doing a video for removing soiled colostomy and replacing it with a new one on a patient simulation. So here we go. Knock, knock. I'm washing my hands. My name is Tisha. I'm going to be performing a colostomy change on you. Can I get your name and date of birth? Okay, that matches your band. Perfect. So I know that this colostomy is not new for you, but if you have any questions, it's just going to be the regular change. I'm going to gather my supplies real quick and I'll be right back. So I have all my supplies, my cleanser, and I'll go ahead and put, usually I use a bag and have like my towels in the bag, but we're just going to pretend that this is my bag. So all my clean towels are in my bag and my clean supplies. And I have a basin here with warm water and soap. And I also have a garbage can down here to dispose of soiled stuff. So now that I've washed my hands, put my gloves on, I'll start by asking the patient if they're comfortable. Are you comfortable? Would you like to sit up for this? She's okay with laying flat. I'm going to expose your colostomy now. I'll try to just expose the bag. I don't know if you can see it from here. Can you see it? Alright, so I'm going to put a waterproof barrier between you and this in case something spills out, or I use a bag and just put it underneath in case anything comes off. And then we'll go ahead and start removing the old bag. So we're going to push the skin away from the wafer. Are you okay? Any issues? Any uncomfortableness happening? No. So we've removed the old bag. I'm just going to wash my hands again because I'm like that. So I'm going to go ahead and wash my hands and put new gloves on. And I'm going to be inspecting the skin while I do that. So there's no breaks in the skin, no redness noticed. So we can go ahead and start cleaning the adhesive away. So we'll use the cleanser and I'll spray around it. And then my warm washcloth, I'm going to wipe away from the stool. And put it in my dirty bag. Just pretend I have a dirty bag here. Alright, and then I'm gonna let the skin dry. I gotta put some skin prep down to protect the skin from the adhesive on the new wafer. So I don't have one with me, but if I did, I'd open the package now and I would apply the skin prep around where the wafer will be. And then I'll let it dry for 30 seconds. While I do that, I will go ahead and get my wafer out and I'll measure, with my measuring tool, whether it's a ruler or something else. And then, so I've got 35 millimeters. So we'll go ahead and cut that out on the wafer. Everything going okay? We're almost halfway through. Okay. Now that I've cut it out to measure, I'll just check to make sure that it fits, and it looks like it does. So we'll go ahead and remove the plastic backing first. Do you want this colostomy facing down or towards the side? Do you have a preference? No? Okay, so we'll just go down. Alright. So then we'll just kind of make sure that that adhesive is on there good, and then we'll take this white border off. And we'll just check to make sure. So the stoma is nice and pink and it looks good. Does that feel okay? All right. So I'm going to go ahead and make sure this is closed. And it's closed. I'm going to go ahead and put this in my dirty bag. Remove my gloves. Wash my hands. And get you situated. Would you like to sit up now or you want to lay flat? Okay. So now that we went over all of that, I'm just going to do some brief patient teaching, even though I know you've had the colostomy for a while. We just like to remind people that if it's leaking outside of the wafer, to let us know right away so we can get it changed so that you don't get any skin breakdown. If you have a lot of air in the bag and the bag needs to be burped, if you don't feel comfortable or feel like doing it yourself or able to do it, you can call for the CNA or me and we will help you get the air out. If you have any pain around the area at all, or you're feeling anything that doesn't feel normal, or you're seeing any blood coming out of your stomach, please call us and let us know. Do you have any questions for me? Okay. So I am going to go ahead and wash my hands, put my gloves on, and remove all this rest of the equipment from the room. Yes, that's it. You can stop it.